Okay, guys, so this is nutrition and we are on chapter 16. Let me share the screen. And this should be interesting in that it's about nutrition in metabolic and respiratory stress. So we're going to be talking about how, your body responds to stress and how nutrition has an impact on that. Okay, so learning objectives. We're going to talk about the stress and inflammatory responses and what the long-term potential damaging effects are of those. We're going to describe nutrition care of very acutely stressed patients, medical conditions that can lead to respiratory stress and what the causes are, what are the consequences, what are the treatments, multi-organ dysfunction syndrome. Identify major risk factors and approaches to treatment for this condition. So let's talk about how the body responds to stress. When you are stressed, the body's response really changes your metabolic rate, changes your whole metabolism. It can change it enough where it can actually do damage to you and threaten your survival. When you're stressed out, you have higher nutritional needs. People don't realize that. Just because your metabolic rate is typically increased, you have an increased risk of malnutrition, right? If you're not taking in enough during these periods of stress. And with metabolic stress, there's something called homeostasis. And that's like a natural balance that your body's supposed to be in all the time, right? Everything works together. There's not one system in the body that works in a silo, independent of the others. They all have to it's like an orchestra that plays a beautiful song together. If one part of it is disrupted, everything is disrupted, right? So the whole environment of the body can be in danger. So respiratory stress, what does that mean? That means that you're not getting enough oxygen or you have too much carbon dioxide in your blood and your tissues. So we all know oxygen is what we need. That's what, keeps our cells, moving, and carbon dioxide is the waste. Not enough oxygen, hypoxia, that's what that's called. And too much carbon dioxide in the blood, hypercapnia. Okay, just for fun. So metabolic and respiratory stress, you have consequences that can be, like I said, life-threatening. There's one that's called hypermetabolism, and it sounds like what it is. Just think about it. The metabolic rate kind of goes into overdrive. Just picture driving your car at 120 miles an hour constantly and without letting up on the gas, right? And think about the wear and tear that it puts on the tires and the engine and everything else, right? Same thing with the body. So, when you are under stress, that's why it's important, and I can't emphasize this enough, to learn how to manage stress, because you can't make it go away, right? There's no magical cure. If there were, I'd be a gazillionaire, right? But you have to manage it so that it doesn't take over your life, because you have these stress responses in your body. Some of them are specific, some of them are non-specific, but all of them potentially are harmful in a lot of different ways. So your body has a natural instinct to want to survive, right? That's just human nature, right? And so when the body feels that it's under stress, your brain starts to get stressed out, you're worried, you're anxious, those kinds of things. Anything that you have in storage in your body, fat-soluble vitamins get stored, right? Different nutrients get stored. Well, the body will go, I don't know, we're in trouble. Let's get them out of storage. We're probably going to need them. So you'll start to deplete anything that's stored. There's glycogen that's in the liver. So the liver will go into gluconeogenesis and turn it into glucagon and put it back into your bloodstream. That's why when people are stressed out, if they're diabetic, their blood sugars go through the roof, right? Yes. Yep. Yeah. So again, it's managing stress, because we all have stress, right? So, but do we let it make us like, oh my God, what am I going to do? Or do we say, all right, this is what's happening right now, I got to deal, But yeah, there's definitely a physiological response. Yeah. There's a whole series of things that happen, right? And that's the problem. So think about something like fight or flight, right? Everybody is at least a little familiar. You've at least heard that term before, right? It's the sympathetic and the parasympathetic nervous system. And that is the thing that has helped us survive as humankind. So back when we were cave people, if there was, a threat of something, either another tribe, maybe, with people that were going to come hurt us, or an animal that was going to hurt us, our body would start to pump out norepinephrine, right? And that comes from a very primitive part of the brain, right? Brain's like, we're in trouble. Oh my gosh. Norepinephrine, which is like adrenaline, right? And what it does is it diverts blood flow away from your digestive tract, and it diverts blood flow to your arms and your legs so you can fight or run, right? And your palms get sweaty, right? The heartbeat will increase because it's like, we need more oxygen. We're going to have to fight or we're going to have to run away. Your body's preparing to take some kind of action. And then once the threat is over, you go into that parasympathetic, it's like the letdown, right? And you're tired. Anybody that's ever been in a fight, I don't know if I'm allowed to say that, but afterwards, you're like drained. You're exhausted, right? Because it's all that adrenaline is just gone, and your body now has to kind of recover, right? Stress does almost the same thing. And if you are under sustained stress for a lengthy period of time where it's like not letting up, that's even more damaging, right? Think about it. There's another chemical called cortisol that we have. That's our body's own natural steroid, right? Kind of like prednisone or methylprednisolone. When you're stressed, your body will start to release more cortisol. Cortisol will make you plump up. You get a little gut going on with cortisol, right? It's a steroid, right? And so it does that for a reason, because it's anticipating, I don't know, we're stressed out, something is wrong. So your body's just going into that primitive state, thinking that we got, you got to throw down or you got to run away. The problem is the stress that we have as modern humans, neither of those two options are feasible. You're going to take a test, you can't beat up the computer or your teacher. You can run away, but it's, not conducive to a good grade, right? So we can't use those chemicals that are being released. And so what happens to them? Right? Think about it. So you've got all that adrenaline and nowhere to go. And that's the heart racing and the sweaty palms and, oh, geez, and the foot tap, right? And it's not healthy. It's putting a strain. All your arteries will tighten, literally, when you're stressed out. People can even have like a pseudo MI, in other words, like a heart attack, what feels like a heart attack. And anybody that's ever had a panic attack will know that panic attack feels like a heart attack, like you can't breathe, can't catch your breath. I worked in an ER. I mean, anybody that came in with those symptoms, you rule out the heart attack first, because it could be, So the bottom line is that stress will kill you over time. And so you have to find ways to manage it effectively, because it's never going to go away, right? In life, we have stress. So let's see. Heart and respiratory rates increase. Basically, the PowerPoint is saying everything that I just kind of ad-libbed. And long-term stress causes damage or illness. Yes, it does. Here are the hormones, hormonal responses to stress. So catecholamines, which are the epinephrine and the norepinephrine, and that's raises your blood pressure, raises your heart rate, your metabolic rate increases. Glucagon comes out of the pancreas. Cortisol, when those levels go up, it'll actually degrade muscle tissue while building fatty tissue. Glucose and fat metabolism starts to increase. And then there are other chemicals, aldosterone and antidiuretic hormone. They come from the adrenal glands, which are over the kidneys. They're the ones that help the kidneys decide how much fluid do we keep in the body and how much fluid do we pee out. They keep a fluid regulation and blood pressure and acid-base balance regulation. They go crazy. And so your whole body is simply just out of whack, right? Cortisol, depletion of protein, impairs wound healing, inhibits protein synthesis, increases insulin resistance. That's why diabetics and even people that aren't diabetic under prolonged periods of stress may find if they were checking their blood sugar, they might see elevated blood sugars because of those cortisol levels. And your immune response goes down. So when you're stressed out, you're vulnerable. You're more likely to catch something where maybe you wouldn't have caught it if you hadn't been at that vulnerable place, right? Infections and those kinds of things. There's a nice chart. It really does a pretty good job of breaking down the different hormones like the catecholamines and glucagon and cortisol and aldosterone. And then there's an inflammatory response. It's a non-specific kind of immune response that happens for any time that we develop an infection, we catch something from somebody, or if we get injured. With COVID, when people were dying from COVID-19, they were dying because of a cytokine storm. Cytokines are part of the immune inflammatory response. So cytokines are kind of like, warning, warning, there's an infection here, and they all rush to the site. And if the infection's in the lungs and that cytokine storm occurs in the lungs, that's where respiratory failure follows. So it's this inflammatory response. Normally, it's a good thing because it's what helps get all the white blood cells to wherever the problem is to fight the infection or the laceration or whatever happened. But with COVID, it was too much of an inflammatory response that was causing people to go into respiratory arrest. There's a nice chart here. This is slide 10 that does go through the inflammatory response and how it happens. So you want to take a look at that. We have different types of white blood cells. Macrophages, specifically phagocytes, they're like Pac-Men. That's the way I describe them when I teach this. And they eat up bacteria or viruses or fungi or whatever the cause of the infection, whatever microbe is making you sick. They kind of engulf them and eat them up. It's pretty cool. And then other inflammatory responses, anybody that's got any like allergies to nuts or bee stings or any of those things knows about the histamine response, right? So histamine is the thing that we have in our bodies that causes our eyes to get red and start to tear, causes our nose to run. And also, if it's an extreme histamine response, it will cause edema in our throat and mouth, angioedema, and the tongue will start to swell up and they can't breathe. The trachea will close. So, that's an extreme inflammatory response. And that just happens to be associated with an allergy. And here, look, they even talk about cytokines. I didn't even read this PowerPoint before I got here, so I'm just ahead of the PowerPoint. And let's see what else. Talked about that. Okay. All right. So, what are the nutritional requirements for people that are having these metabolic changes when they're under stress, right? Because there are problems like hyperglycemia. Like I said, blood sugars are going to be elevated. Insulin resistance, which only adds to the problem. So even if your pancreas is making enough insulin, the cells become resistant to it. And so the insulin is the transporter, it's the Uber driver. The insulin can't transport the sugar or the carbohydrates to the cells because the cells are resistant. And then you have a problem with all the sugar being trapped in your blood, right? Hence the hyperglycemia. Hypermetabolism, like I said, everything is kind of in overdrive. Negative nitrogen balance. That's another problem where basically the gases that are in your body because respiratory issues. Do you ever hyperventilate? If anybody's ever hyperventilated when they've gotten anxious or something is happening, what you're doing is you're throwing off all your acid-base balance in your body. Okay, so when you're feeding somebody who's in this stressed state, you have to be careful. Because if you feed them too much, they can have something called refeeding syndrome, or you can watch their blood sugars just go off the chart. And both of those things are very dangerous. So how do we determine how much the energy requirement is for somebody? Think about somebody who's in intensive care, right? And how do we decide what we need to give that person? They use something called indirect calorimetry, which looks at what's the patient's BMI, and then we look at what their energy requirements are so that we take their body weight by a factor that's appropriate for whatever their medical problem is. So if they're in because of a respiratory issue, because of a cardiovascular issue, there are different metrics that are used for that algorithm to figure out how many calories does that particular patient need to sustain life while they're in ICU. And usually they need more protein. A general rule of thumb is when you're under stress, your body has a hard time synthesizing amino acids, which are proteins. So you need more protein. And here's how we estimate, you don't need to know this, but they have, some acute illnesses like, minor surgery, acute kidney injury, burns. Burns are a tough one. When people have suffered significant burns, And that's considered anything more than 20% of the body surface area, right? That's a bad burn. And there are numbers that go along with those different diagnoses that we use to figure out what the required nutritional needs are for that particular patient. Most of your energy is supplied by carbs, right, in general. So, when you're under acute stress, carbohydrate and fat intakes, you really should have 50 to 60% of your diet should be that. And micronutrients, you need vitamins A, vitamin C, and zinc, rather. So they play critical roles in immune response and in wound healing. You'll see, especially people in nursing homes, as you get older, you lose collagen, skin gets thin. Older folks have a difficult time with wounds. So if they develop any type of a wound, they usually will take forever to heal. And so one of the things that you'll see is protein powders or protein shakes, in addition to vitamin A, vitamin C, and zinc added to their diet to try to help that process along for wound healing. Fluids and electrolytes, they also have to be managed very specifically. There are narrow windows of what, electrolyte levels should be in the blood. Nutritional support may be necessary if a poor appetite, right? Okay, so sometimes we have to give people enteral or parenteral nutrition. In other words, we may have to, if they're in intensive care and they're in a coma or they're not conscious, we may have to feed them with a feeding tube. Or if it's something that involves the digestive tract itself, we may have to feed them with IVs, like total parenteral nutrition, right, and lipids. So we're going through some disease processes here. So COPD, everybody's probably heard that term, maybe in passing. It's chronic obstructive pulmonary disease. It's chronic bronchitis, emphysema, and asthma are the three diseases that fall under that umbrella of a COPD. And what happens with COPD, they can get air in, but they can't get it out. So they wind up retaining carbon dioxide and become hypercapnic. When people with COPD pass away, they're passing away because of an acid-base imbalance called respiratory acidosis, because carbon dioxide is an acid and it throws off the balance in the blood. Third leading cause of death in the US. I don't know how accurate that number is, but okay. So there's a little chart here, a picture rather, depicting how air goes through the trachea to the bronchi, the bronchioles down to the alveoli, and then there's an exchange of oxygen and CO2, et cetera, et cetera. So usually there's damage to either the alveoli, which is what we find with emphysema, so that air exchange doesn't take place, or like with asthma, if anybody knows anybody that has asthma or has asthma, stress can trigger an asthma attack. And what happens is everything gets constricted, right? The bronchioles and the bronchi will actually tighten up. Air can get in, but then when they breathe out, you hear that wheeze, right? That's that tightened airway. It sounds almost like a flute. And COPD is degenerative and progressing. So in other words, it's not going to get better. It's going to get worse, and it's only a matter of time, sadly. There's nothing really to do about it. Causes: cigarette smoking, nuh-uh. So absolutely, smoking is not good for you. Public service announcement. And then there's a genetic susceptibility. So there's a genetic susceptibility for every disease process. I think I talked to you guys before about the human genome and how much it really has an impact on the kinds of things, predictable things that can happen to each of us. So let's see, treatment. So the treatment for COPD is we want to try to prevent it from getting worse. We can't make it go back in time and get better. So if we can kind of stop it in its tracks, we're doing a good thing. Tell the patient they should stop smoking. Everybody should get vaccinated for the flu and for pneumonia, absolutely. And medications like bronchodilators and corticosteroids are used frequently. COPDers usually are thin people. Why? Because can you eat and drink and breathe at the same time? Can't do it. And so if you go to take a sip, you have to kind of hold your breath for a minute, right? When you swallow, otherwise it'll go into your lungs, right? You'll choke. So over time, people with COPD have such a hard time breathing. You'll see them sometimes leaning over a table, right? Because it makes it a little easier for them to breathe. And they won't eat. They won't eat. Or if they do eat, they'll eat tiny, tiny little portions. And if you show them a plate, like a full dinner plate, it'll make them actually to the point where they're nauseous and they won't eat anything. So what we try to do with the COPDers is, again, the most bang for the buck, like protein shakes, right? Things that are going to be easier for them to get into the body and not a lot of work from a respiratory perspective, you know. Respiratory failure. So that means that the gas exchange between the air and the blood is impaired. So in other words, the oxygen is not in your bloodstream. It's not getting there for whatever reason. There's something called ARDS, which is acute respiratory distress syndrome. Usually it starts with some kind of an injury to the lung. It can be something traumatic like a shooting or a stabbing, or it can be, you know, the cause of, or the subsequence of a, like a motor vehicle accident or something like trauma to the lung. But what can happen with some people, it can progress to multi-organ failure. And that's when it becomes, you know, when you see people in ICU and intubated, you know. So the next slide shows somebody in ICU intubated. They have an endotracheal tube. That's the tube that goes into their mouth versus a tracheotomy, which is where we have to actually cut a stoma into the throat, directly into the trachea. And they're on a mechanical ventilator. So the machine is actually doing the breathing for the patient. And it actually has pressure behind it so that it pushes the air in, because they're not able to do that. So the machine pushes the air in and helps the air come out. Right? And it does that, whatever the settings are specific to that particular patient. With respiratory failure, I already said this, acidosis is what's going to kill them, because when you're hanging on to carbon dioxide and you don't have enough oxygen, carbon dioxide is acidic. And so the pH of the blood starts to go lower and lower. And there's a narrow window. Blood pH is 7.35 to 7.45, super narrow. If it goes down to even 7.3, you're like, well, that's not a big difference from 7.35. It's enough to make the transport of oxygen in the blood next to impossible. So it's a critical condition. The patient will look cyanotic. Cyanosis is a blue tinge, right, to the skin, and that's from a lack of oxygen. Treatment, mechanical ventilation, right? Diuretics sometimes, which are medications that can help us get excess fluid out of a patient, and different other types of medications, and of course, oxygen. Nutrition therapy, the same principle applies here. We have to make sure they're getting enough to sustain their basic metabolic rate, just being there, just being alive. Right. And so it's usually 25 to 35 kilocalories per kilogram of whatever the patient weighs. And again, increased protein. Right. In almost every scenario here, you're going to see a need for increased protein. Usually with respiratory failure, it says they may be unable to eat. They're not eating. They're either going to have a G tube or a J tube in, a tube that goes directly to their stomach, right? Because they're not going to be able to eat and swallow. As long as there's not a problem with their digestive tract. If there is, then we go to the IVs. That would be the next step. Multiple organ dysfunction syndrome, which is basically multi-organ failure, okay? When people have a really severe inflammatory response, like I'll go back to COVID, right? That cytokine storm I talked about. So when that happens and this inflammatory response happens, one by one, the organs will just start to shut down, right? So it starts with the lungs, but then it goes to the liver, the spleen, the kidneys, the heart, the brain, you know, so everything will shut down. Usually it starts with the lungs. It can start with the liver, people that drink a little too much, that have cirrhosis, which is damage to the liver over time. It's like scar tissue that builds up in the liver. You'll see them sometimes go into multiple organ failure, sadly. Mortality rates are very high. That's an understatement. People don't usually come back from that. It's very, very highly unlikely. If you're over 55, you're more of a risk, obviously, because you're older. Let's see, infection, critically ill patients. The big thing we worry about with people that are critically ill is the development of pneumonia. And we worry about that in patients, even if they're just like a post-op patient that's bedbound and they can't get up and move around, because we all have secretions, right? But we move around. And so it mobilizes the secretions in our lungs and we're able to, you know, get them out. When people were bedbound, those secretions kind of will sit. And when they sit, they can actually become infected and turn to a pneumonia, right? So there's mechanical ventilator induced pneumonia. That's a thing. Different types of pneumonia. Pneumonia is usually an infectious process. You get it from a bacteria or from a virus, but it can happen because of aspiration or mechanical ventilation or immobility too. So there are lots of different kinds of pneumonias. Let's see what else. Multiple organ dysfunction syndrome, and they talk about sepsis. Sepsis is basically it's a generalized infection of the body that leads to septicemia, which is an infection of the blood, which leads to septic shock, which is a shutdown of all your organs, which leads to death. Right. So complicated processes, but they definitely can happen in events where you wouldn't think they would. As, you know, when, again, I go back to COVID. There's a nice chart here. This is slide number 12, and it goes through the different organs or body systems and how they're affected when there's multiple organ dysfunction syndrome. Like we have a coagulation system in our body that's complicated. So in other words, when you get cut, you'll stop bleeding. You put some pressure on it, right? And it'll develop a scab and the bleeding will stop. Well, your coagulation will be affected by this as well. So you have 12 clotting factors, and they're literally factor 1, factor 2, factor 3 through 12, right? You have platelets or thrombocytes, which help with clotting, fibrinogen, prothrombin. So there are lots of processes in place for your blood to clot, and they all go haywire when this happens, right? So it's almost like total chaos is the best way I can explain it. So when someone is septic, we have to act quickly to prevent that from becoming septicemia and septic shock, because at that point, the organs are just, everything starts to just shut down because it's all just going crazy, if that makes sense. Okay. And what is the treatment? You know, support for the lungs, which means mechanical ventilation, fluid resuscitation, which means, you know, basically getting enough fluids on board and the right types of fluids, hypertonic, hypotonic, isotonic, depending on what the situation is, to make sure that the balance of fluid in the body is correct. Kidney support, we got to protect them against infection, so they'll be on IV antibiotics. And then nutritional support, because it's easy for them to develop wasting, is what we call cachexia, where they just start to lose weight and then degrading of the muscle tissue, and they're just like a walking skeleton. And that's the end of this very happy and upbeat chapter. That was fun, right? Let's stop that and see you later, alligator.